Barbara, I'm glad you're on here today, but I figured out what I want to be when I get older,
What's that?
younger.
Oh,
And,
plan.
I think I found a way. It's welcome to Lifewave. It's how to look vibrant, how to feel great, how to enjoy life as we age. I mean, aging's kind of a strange thing if you think about it. It's some people enjoy it, some people don't, and some people have more life in them as they age compared to being younger. I think it's I think it has something to do with the fact that we learn more about ourselves and our body and how to take care of ourselves better as we get older if we work on that. So the thing is what if you could change the trajectory of aging, and what if you could be younger or more youthful? Well, it's interesting because we have patches that actually say that if you wear the X39 uh, patch, that 6 weeks of wearing the patch will reverse age your cardiovascular system by 8 weeks. And so you can actually gain on it. This is a picture of Allie, and Allie's 30, in her 30s, and she lives a healthy lifestyle, but she can't do all the things she used to do when she was 20. And it's kind of interesting what 10 years difference would make. I mean, I remember myself when I just playing football out in the field at 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 18, in high school and senior in high school, and then just 4 years later at 22, I remember playing out with friends, and I ached for days after that. My body would just not take as much. And so in this case, it kind of states, Allie can't party all night anymore, and doesn't want to. You can see that she's taking better care. And this actually is a picture of our friend Dr. Stacy, who is 50 years old now. It says here late 40s, but her biomarkers say that she's 25, which is half her age. And the reason that is because she has focused on prevention. Longevity is a priority for her, and she's learning new ways to stay healthy. And this LifeWave product is one of those ways. And as we age, we all have stem cells. We get our supply of stem cells at birth, and as we age, some of those go dormant because they're just not needed anymore for the growth and development. But they go dormant; they don't go away. And so here's Carla in her 50s, and they say that by the time you're 30, half of them are gone, or well, dormant, not gone, but dormant. And so Carla, is a little more, probably has a few more dormant than that. And she wants to play with her grandkids, and she wants to be able to get up and down off the floor, which is kind of hard to do. Myself at 77, getting off the floor sometimes is one of the hardest things I do. You know, and then Ben in his 60s, as I just said, it's probably, maybe have 5-10% of the stem cells active. And his concerns, as you get older, you worry a little more about heart disease and prescription medications, you know, and just, this is a picture of him kind of running, but, running or jogging can take a toll on your knees, you know. And so we have a friend that, was having some issues, and says, have you heard about the patch? What do you know about stem cells? In fact, we ask that question all the time to people. What do you know of stem cells? And it's amazing. Just yesterday I talked to a guy who was running a store manager, and he said nothing. You know, no clue. So this is kind of a graph of where we go as stem cells are declining, and that's the activation or the dormancy of them. And what about injections? Stem cell injections, you've heard about that. But you know what? People go to Mexico and other countries and spend thousands of dollars to get an injection. And first of all, I just said thousands of dollars. So that tells you right away it's expensive. They can be painful. 80% of the time they're effective. And when they are, they're great. But they actually, it's also invasive. as possible side effects. It's not your normally it's not your blood or your stem cells that's being injected. So, you look at that and is there a better way? And that's the next slide. Is there a better way? Is there an affordable alternative? Would you be interested? Here's Dr. Smith, and he is amazing. At this point, he's got 200 patents. He started working with the Navy SEALs in 2004, creating some energy patches and helped them not use amphetamines and caffeine as they went out on their long missions. And right now they're in 80 plus countries, got 15 distribution centers. We work with someone in Australia ourselves, and they have a distribution center there. And so they don't have to wait on their patches. And it's just the amazing things that have gone on and they're going on. This is patented phototherapy. It's a wearable patch technology. It's actually, if you think about it, it's non-transdermal. There's no drugs, no chemicals in it. It just is a reflection of your light back into your body. And 80 clinical studies have proved that, it can reduce flame and inflammation. It speeds up wound healing. And this is just some of the, when stem cells activate, these are just some pictures that go through. This is a lady that was suffering from radiation. And you can see that just within, 20 days, she's getting better. And on June 30th, there's even a better picture. Wow, in a month. This is actually Barbara, who happens to be on the call, but Barbara, this is her ankle. She fell. She dislocated the ankle, broke it in 3 places, and after the initial break, had no pain. When the paramedics came, they asked her what they could give her for pain. She said, "I'm not in pain." She went to the ER, and the ER doctor says, "This has got to hurt. What can we give you for pain?" She says, "I'm not in pain." And so, and it's been, she spent a little time in a wheelchair because they kind of casted it, but she went from wheelchair to full weight bearing with very little pain. I think I remember the strongest thing she used was she took an 800 Tylenol and broke it in half and took 400. And this is Amy, who's down in Australia. And this is like, you can see, my gosh, look at the difference between day 1 and day 365. She looks much, much younger. So, and here's Marcy. Marcy is our friend. Marcy, in 2019, Marcy actually, this is a picture of her after a year of chemo, radiation, a double mastectomy, and a spot came back. And she's home and she thinks she's dying. And a friend of hers, who's a doctor, came over, gave her 10 of these little white patches and said, Marcy said to her, "I'm dying and you want to give me a Band-Aid." And the doctor said, "Well, it's so much more than that." And so Marcy's been in remission now for over 4 years. And this is a picture of Marcy and us in 2004 in December. So you can see that, she's alive and well. This is not an actor. This is not someone paid to be on a picture. This is a real person. And these are real people that we're working with that have been helped by this technology. Here's another lady that you can see that the collagen, the increase in collagen is helping. This is one of my favorites, actually. This is a spine. And you can see all the impingements on the left-hand side. And basically, that's called pain. And on the right-hand side, after 2 years of patching, it's clear. Now, with no surgery. And by the way, yes, it took 2 years, but no surgery. And it's just amazing. This is an 8-year-old boy that the tip of his finger was completely cut off, and doctor did not want to sew it back on, but the mom said yes, and so they sewed it back on using X39 patches, and you can see it completely regenerated. Here's a guy who has a bald spot that looks like it's filling in, because stem cells go where your body tells them to go. You don't know where your stem cell is going to go if it's self-directed. When you cut yourself, you don't say go heal that cut. Your body knows where to go, and it heals it. We even have a patch for animals. Your furry friend can get helped as well. This picture came from, Dr. Horman, who is in Boise, Idaho. He's a chiropractor, and he works neuro. That's basically all he does is neuro. And you can see the session one where it's a 77-year-old woman that has her brain is inflamed, if you will, for lack of a better term. And after some stem cell activity with the patch, you can see that it's calming down. And so I've also personally had people tell me that they just feel better sometimes. And some of them have said, their brain seems clearer. I've worked with a real estate agent, and he said, normally when I'm this busy, I'm a little more flustered. And right now, he says, I'm not, no, everything's clear, which is amazing. So better sleep, more energy, faster recovery. Doesn't everyone want that? I mean, do you want that? These athletes want to increase their endurance. They want to have more energy, and that's what. Here's David Beckham wearing the energy enhancers, which was created for the Navy SEALs in 2004. Here's Serena Williams. So all these people, if this didn't work, they wouldn't be using it. So what if you could be younger? What if you could be more youthful? It is possible. It's possible to activate your stem cells. It's possible to create more energy. It's possible to have more mental clarity and faster wound healing. I'm waiting to look younger, but I think it's coming. Muscle, bone, tissue, nerve, improved sleep. So if anything were possible, what would you do different? Are you open-minded enough to look at something that is different than a pharmaceutical pill that you take? Well, this could be the answer. Right here, we have three different options for you. The Core Pack 295, by the way, you can get one X39 retail at $149. With this Core Pack, you can get up to four different options for $295, which is a much better deal. And the secret is the bigger the package, the less you pay. And so, my thing is, I guess today, if you're interested, get back to us, put something in the chat, and let us know how we can help you. We'd really like to just see what your needs are. See, if you have someone in need, let's try to chat and see if there's something that can be done to help them.